I vividly remember looking at those pictures on the wall and pointing at them and just giving Jared this like fist. And I would point at that wall and I would do this. And I was like, that's why I'm fighting. And I didn't want them to give up on me. I know I'm like this medical mystery that no one knows what's going on right now, that you guys are all confused. No, there's no answers. Even though I can't talk, can't move, don't give up on me. I'm still in here. I was cognitively aware, couldn't talk, but I'm fighting for that girl on the wall.
Yeah.
And that family.
From the provider side, right? It's so easy in a lot of ways, especially when you're really busy, you're stressed, your cup is empty, to look around the hospital, look around the clinic, look around the ICU, and see diagnoses instead of people. And little things like that, like the pictures on the wall, having people's family members there, it helps to remind us in those times when we may not have the awareness or we may be running on empty. It's that little extra reminder that these are people, right?
Hello, everyone, and welcome to the Medical Trauma Support Podcast. Today, we have Vanessa Abraham back, and this is our part 3 of our 3-part podcast episode series that we've done. And the super exciting thing that we're doing in this final episode is we have Dr. Jared Rosen here joining us. And Dr. Rosen was the doctor that was with Vanessa in the first part of her ICU experience. And so I'm super excited to talk to both of y'all and get like your different perspectives on things, and for other people to hear about your relationship and the support that Vanessa received from you, Jared, and how the experience with her in the ICU had a big impact on where you decided to go in your medical career and what you decided to focus on. So welcome, y'all. I want to give you a second to add anything else to introduce yourself to the listeners if you'd like to do that.
That's awesome. Sarah, thank you so much for having me on. Vanessa, it's so great to see you. You know, it's been a while since you and I have seen each other in person, but
I know,
I'm really happy to be
I
here
know.
with you guys and chatting.
Yes, and thank you for joining us. And Sarah, thank you again for round 3. I'm so excited to dive in and have this conversation.
Yes, me too. So for people who have not heard the first 2 episodes, Vanessa spent a number of weeks in the ICU and recovering from a virus that significantly impacted her body. You can go into more specifics if you want, Vanessa, but within that time in the ICU, it was very unexpected. There was a lot of fear and anxiety. And the thing I really want to start with here is in Vanessa's book, Speechless, she talks about how each person that walked into her room throughout this whole process or time frame that she was in the hospital, the energy and how they came in and how they treated her was so impactful to her, especially when she was in this really vulnerable position. So, Vanessa, I would love to hear a little bit more from you about what that was like to have a new person, like a new nurse walk in, a new doctor walk in. And in your book, you talk about how some of them that would walk in just brought this like sense of comfort and peace to you.
I was very blessed during my medical experience. It was horrific, don't get me wrong, and there's a lot of trauma associated with a lot of it. But overall, the energy that was brought into my ICU room really, I don't know if it so much saved my life, but it just brought my anxiety down tremendously. You know, in my book, I think there's a chapter called Nurse Anxiety. And every time they would walk into the room with me, they would introduce themselves. I'm going to be your new nurse. They knew that, wow, this woman is very anxious. If I walk into the room and I just introduce myself, talk to them about what we're going to do today, what the schedule is going to look like, that would bring me down immensely. But just little things that they would do, you know, just holding my hand, talking to me, asking me about my daughter, asking me how I'm feeling. As Dr. Rosen knows, at the time, I was nonverbal. I couldn't talk. I was using things such as an alphabet board, a piece of paper, and I was typing letters on a piece of paper. But they would sit down with me. They would take the time, even if it was just, a couple minutes here and a couple minutes there, and just ask me questions. How are you feeling? What can we do for you? Speaking of the energy too, they even had some lavender going, that they would put lavender on my feet just to try to calm me down. Again, I was just so blessed at the ICU that I was in, that they took the time to give me those little comforts that really meant the world to me, and to my husband too. He was scared too. He went from one day working full time just like me, being a dad, being a husband, and going to work, and within a week's time, his role got flipped upside down too. So they took the time to be with him as well, and that was just unbelievable that they could take that kind of time and turn a really, really scary experience into something as positive as it was.
Yeah. And Jared, I'm curious what it was like for you when you first walked into Vanessa's room. And probably, I'm guessing before you walked into the room, you were reading her chart, the information about what had happened up to this point. What was that like for you?
Yeah. So, I mean, I kind of had a unique perspective. This was my very last month of medical school training, right before I was about to start my residency in late spring 2019. And so I had this unique perspective of, I was an important member of the team, but it wasn't essential, and I had fewer responsibilities, and so I had some more time. So I remember that morning, the resident who had been on overnight came and we were rounding as a team and was talking about what was going on. Vanessa had been transferred for another hospital for for sort of higher level of care, some more specialty care. And just hearing about this, and my initial thought was like, wow, this is horrible. This young woman, this is happening. And then sort of the other part of my brain is, wow, this is an interesting puzzle.
Mm-hmm.
And I wonder what's going on. And I want to try to see if I can, help in my small way as a student. There are a lot of people with a lot more years of training and experience, but I want to see what I can do for my part. And so I think that was sort of my kind of initial impression of what was going on, was just sort of like, how can I sort of use my brain to think this through?
Mm-hmm.
But then also, gosh, this is such a horrible thing.
Yeah. And I'm curious, you said that you were a student, so you didn't have as many of the responsibilities. How much of your ability to really like spend time thinking about it and be so like from what Vanessa's told me in her book, you were so like present and attuned
Mm-hmm.
to her. Like, what support did you have that allowed you to show up in that way?
I mean, I think a lot of it was structural. I had, fewer responsibilities, fewer patients than I did as a resident, sort of a few months later. And I think that was really the biggest thing that allowed me to be able to do that as much as I did. And I think, I was lucky in school. I had, good mentors, and you see positive examples, you see negative examples, and it's sort of up to you as the individual to figure out, who do you want to be. And I think one of the great things about this was, being able to work with Vanessa and get to know her, is it let me kind of help me really kind of figure out and codify, who did I want to be as a medical professional, right? I'm like early in my journey, and how do I want to be with my patients? What are going to be my values? Not that I could always entertain them to the same level that I had when I was a student taking care of Vanessa, but how do I form those core values? And I think it was really formative.
I think that's so beautiful, right? Because the impact that y'all had on each other's lives was really profound.
Mm-hmm.
And why I think y'all are still in relationship today, and still still message each other or text each other and stay in contact. Right. And this isn't the first podcast y'all have done together. So I just think it's such a beautiful story. And I love that you had the good support and the good mentors that allowed you to show up in that way with her.
Mm-hmm.
I think that's so beautiful.
I'd like to add too, when he first came into my room, and he knows this, I did not want him in my room. I wanted him gone. I was angry. I couldn't talk. I was just kind of paralyzed and unable to communicate. But that relationship unfolded into this beautiful trust. And I think that is so rare. Just, he was there for me. I was scared, and he knows this. He he knew my anxiety levels. He'd come in the morning and read what went on through the night and see how much anxiety meds that they had to give me to bring me down for brain scans and different things. And that relationship changed within days, from me being angry that he was in there and why are they sending this guy in there? He doesn't look like he knows what he's doing. He's a student. And then I saw him almost take my husband, and I got goosebumps and I'm a little teary eyed, but he wrapped his arms, not physically, but gave him such comfort. And that to me was a signal that this is a man to be trusted. He took my husband, who I knew, I was scared. I was worried for my husband's sake. I thought, he's got to be terrified right now. Here's his wife, his mother of his child in bed. You know, she could very well die. I was very worried about him. But when Jared walked into the room and would take him to rounds, and not necessarily hold his hand, but hold his hand, if you know what I mean, and take him to doctor rounds and explain to them what they were referring to and simplify it. You know, there's a lot of doctor jargon that most of us don't, 99% of us don't understand because we're not in that field, but simplify it with him and say, well, this is what they want to do with Vanessa. This is what they're thinking might be going on. This is what the tests are revealing. And for him to do that and take that time with him just gained my trust so quickly that it went from this relationship of, who is this person, to I want that person in my room every day. Everybody else can leave. I don't care what anybody else has to say. I want him in my room, and I want him in my room every day. Do not let him leave. At night, when he did go home at night, it was like, crap, like he's leaving, my husband's leaving. Who's going to be here to advocate for me? My two people, they're gone. What's going to happen? And that, in the book, I go into greater detail of what it was like when he officially had to leave to graduate, and what that experience was like for me as a patient, knowing that he was moving on and I wasn't going to see him again. And how was I going to navigate this next chapter? And I was worried about my husband too. How is my husband going to navigate this next chapter of recovery without the person that we trusted the most in the ICU?
Yeah, that makes me think a lot about the intimacy, the vulnerability between somebody and a medical care provider. Like, it is one of the most, for many people, the most vulnerable times in their life, and that the medical professionals are there with them in this incredibly vulnerable, terrifying place. And Jared, what is that like?
It's interesting. When I started medical school, I had no concept of what that would be like. I don't think I don't know if anyone can really think that through. But I look back, I'm 3 years of training to be an internist, and then I just completed my 3 years to be a pulmonologist and critical care ICU doctor. And so a lot of experience taking care of a lot of patients in so many different settings. And I look back and I think, gosh, I walk into a room and in 5, 10, 20, 30 minutes, however much time I'm taking, I'm like, hi, I'm your doctor. We're going to immediately get to the meat of what's going on, and we have to get immediately personal. And it's so automatic for me at this point that, yes, of course, we're going to talk about the sort of deepest, darkest secrets, your fears, your wants, your desire, things that you would take 4 dates to talk to somebody about if you were but I walk in the room and boom, we just got to talk about it. And it becomes pretty quickly automatic because you do it so much. But I look back on it sometimes. I was talking to my friend who's a palliative care doctor last week, and we were like, yeah, we just immediately we have to develop that intimacy because you don't have time, especially, in a critical situation like that, or if you just don't physically have more time, you have to do it. And I think you learn to develop those skills to build that intimacy quickly, to do this well, right? You have to, it's all, and a lot of it is, language that you use and, how you're approaching things, but so much of it is the other things. It's the body language. Did you sit down with the person? Did you hold their hand? Did you bring the Kleenex? All of these little human things. So much of my job is, I have to know the science inside and out. I have to know the medicine. I have to be quick thinking. I have to be able to respond to emergencies. That is my bread and butter. That is my job. But to be really, really good at my job is to have the human side down. Because if I can't humanize myself to the person in front of me, then that's not a patient. That's just a sack of meat.
Yes.
right? I didn't go through all of this to take care of a sack of meat. This is a person in front of me.
Yeah.
So yeah, sometimes I have to turn that part of my brain off because there's an emergency. I got to focus on saving their life. But this kind of gets to what we were talking about a little bit before is, okay, I can turn, emergency mode is off. Remember that this is a person in front of you and
Yes.
that there's their family member with them. Or you got to call their daughter on the phone, right?
Mm-hmm.
And how would you want your parent to be treated or your sibling to
Yes.
be treated?
The thing that is coming up for me, Jared, is first of all, how beautiful. I just love you and I met you today. I think that's so beautiful because the word human is one that I use a lot because there are a lot of people who I've talked to and who've experienced medical trauma who didn't get that, right? And we all deserve that. And I think it's so beautiful. And a lot of what I've thought about is, wait, why didn't they get that? Why wasn't their doctor able to give that? And then we go into like the system, right? And a lot of
Mm-hmm.
people are not supported in the system. They're just totally burnt out
Yeah.
because they don't get the support they need. They don't get the rest they need. They don't get the breaks they need. And I'm curious, how are you able to do that? Like, how are you able to keep that and keep from getting compassion fatigue?
Yeah. I mean, I think one of the things that I tell people a lot is that some of this comes from within me. And I think, I was listening to this podcast recently about, altruism. And, altruism actually exists. And, I think I like to give of myself to other people. I think of myself in certain ways as an altruist. But the reality is, how do I protect against just completely emptying my cup and having nothing
Yes.
left? I get something out of that interaction too.
Yes.
You could argue that I'm not really an altruist. I'm actually selfish. I don't know. Maybe it's a distinction that it doesn't matter. But the reality is, like, I get something out of those interactions too from being able to help
Mm-hmm.
somebody. And so I think I love my job from an intellectual standpoint, from a human standpoint.
Mm-hmm.
I think that is a big protective factor.
Yes.
And I think that's certainly part of it. And that has nothing to do with the system. The other side of it is, trying to put yourself, you're right. There are definitely people who work within the quote unquote system who the things that are asked of them, how could you possibly ask them to continue to be compassionate? Right?
Yes.
They have nothing left.
Yes.
The system is
Yes.
milking them entirely dry.
Yeah.
100%. Right? So I think one of the ways that I try to do this is to seek out places where I will be given that up, where it is valued for me to be able to have enough space to recuperate so that I can continue giving 120%.
Yes.
Because how could you possibly give 120% if you have nothing left?
No, because you're human. To go back to that word is
Mm-hmm.
you are a human. And I
Right.
do think that there are some superhuman expectations for
Yeah,
doctors.
I know. It is. But again, like, I think that's part of it. But I come back to, what motivates me. I did my
Yes.
residency in the middle of COVID,
Oh.
right? My first year of residency, like 3/4 of the way through, is when COVID started. It was rough. It
Yes.
was like what was asked of me and going through all of that and then just going home and then still being scared because I can't go to the grocery store.
Yeah.
And I was definitely burned out during part of that. But what kept carrying me through was a lot of the strength I think we built within myself, even when the system
Yeah.
was failing me. Now, would that have been sustainable for 20 years doing that? Of course not. But I think you have to think about it. What resilience do you build within yourself? What do you get out of your job? Are you getting that fulfillment that can sustain it? And then trying to find places where the expectations are, we're going to give you this space. The new job that I'm just starting right now out of training, when I met with my boss, she said, like, you know what? We want you to take care of X number of patients. We actually added an extra doctor in the ICU because we wanted to make sure that you had enough time to spend with all of the patients and their families,
Mm.
to make sure that you're thinking about everything, that you're documenting everything very clearly. She's like, I want my doctors happy, and I want to be able to give them the time that they need to take care of these patients because that's what the patients deserve.
Mm. That's so beautiful. And those are the kind of places that the clients, the patients want to go to.
Mm-hmm.
right? It's just smart business. It's of course so important for the human aspect too, but it's smart business too, because the care that patients receive there, because they're putting an extra ICU doctor so that the doctor has more time with both the patient and their family. And I think, Vanessa brought that up about how, because you were there with her husband and she could see or at least feel how that helped her husband feel better, that took a layer of the anxiety off of her too. And so, yeah. And for, Jared to have been able to do that is so wonderful. The family is such a huge piece of this experience.
I want to add in too that a lot of it, back to what you're talking about, I think with you, Jared, it's just intrinsically in you. And I think we've had this conversation too, you have a high emotional IQ. And I knew that from day one. And I don't want to say this to embarrass you whatsoever, because I care so, I guess I care so much and I'm so appreciative. And I knew that from, a couple days into that ICU, that this is somebody to be trusted. And I even was reminded of that after I got out of the ICU, after I got out of rehab, came home. And I know you know this story, and Sarah, you and I have talked about this, is that I went on the internet and I kind of stalked you out. And I was like, I got to find this guy again. It's been 4 months since I've seen him. I want to know how he is, and I want to know if he even remembers me. And I'll never forget that email. I sent the email, and within a day or two, you responded. And I said in the email, like, do you remember me? And you said, of course I remember you. And I cried. I cried like a little baby when I got that email back from you that, wow, he's seen how many hundreds of patients since, since I left his care, and he still remembers me. That was huge. I've seen so many students over my course of my career, and I go, oh, that name sounds familiar, but I don't specifically remember this, that, and the other. And in this email to me, he goes, yes, I've been following you, and I see you got a diagnosis. And he was so up to date on what happened with me and what still is going on with me. And that was just like, wow, 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 wow. Goosebump moment after goosebump moment. This man is incredible. And I could only wish that everybody else would have the same experience that I did. And then a little bit of me feels a little jealous, or not jealous, but just kind of guilty that other people aren't having the same experience that I did. And I didn't have this experience through my whole medical journey. This was a very rare experience for me, because after I left his care, things significantly went downhill. But I just wanted to kind of highlight that, because that's really who he is too. It's in him. He's got a good heart.
Thanks, Vanessa.
Of course.
Kind of along this same, topic that we were talking about, Jared, is what do you do to take care of yourself when you're not at work?
Great question.
I laugh at that because I have this conversation with my mom, and beating me over the head and be like, are you taking care of yourself? And I just finished my fellowship training, like I said, to be an ICU doctor. So I mean, those training hours were rough. A lot, not like working 12 days in a row, 80 plus hours a week, taking care of the sickest patients in the hospital. And so it's hard. It's hard to sometimes find the time to do that. I think a lot of it is just the usual kind of things that anyone else would do. It's, it's taking the time to go and get some activity, making sure that you're eating good food, just basic trying to take care of staying hydrated, things like that I can't even say I always am perfect about, but it's things like that really help to just do something to keep you together. But I think a lot of it too is this is what working with people like Vanessa, doing this kind of job is what drives me. And now that I finished my training and I have more free time, I'm like, oh wow, I haven't really had hobbies in the last 10 years of my medical training. I got to relearn how to have hobbies again. This is great. But I think, to kind of get back to your thing, I think it's the biggest thing I think that I did, especially in my fellowship training, was to sit and reflect. I'm somebody who's very hard on myself and looks back and says, what could I have done better? How could I have done that differently? Rather than saying, wow, look at what I've been able to accomplish. And I think it's looking back and saying, yeah, I could do maybe something different tomorrow. gosh, look at the 10 good things that I did today.
Yeah.
And really giving yourself that credit, because you're not going to get, in the ICU. I mean, Vanessa is such a unique experience because I get all of this positive feedback afterwards. So many of my patients are, they don't have the ability to give that, that positive feedback. Sometimes you get it from families, but I don't have that expectation. They're sick. They're in the hospital. It's my job to take care of them. They're not supposed to take care of me.
Yeah.
Sometimes I want that, right? But that's not what they're there for. And so you have to give that to yourself and look back. You know what? I stayed 20 minutes late today because I wanted to call that family member again to give them another update. I wanted to spend some extra time with that person's husband to help them because they're having a tough time. Or, you know what? I made a phone call to the child life social work specialist because this person is young and has a child, and I want to try to figure out how to get them in to the hospital, and figure out a way to do that. It's little things like that, and it's saying, yeah, you know what? Good job. You made somebody's life better today.
Yeah.
I think about several months ago, I had a patient who was dying. He was dying of his lung cancer in the ICU. And, his daughter had just had a baby like a few days before. The little tiniest baby possible. And he knew the end was coming within days. And one of his dying wishes was he wanted to see his grandbaby.
Oh.
Couldn't make that happen and couldn't bring the baby into the ICU because it's such a tiny baby and, regulations and safety. And so between the nurse, myself, the respiratory therapist, the charge, we got the whole crew together, and we made a plan, and we figured out how to transport him with enough oxygen down to the hospital lobby, where we set up a little meet and greet with the baby. The nurse did a whole photo shoot of them together. And it was that little thing. And that brought me so much joy that I could play some small role. I mean, really it was the nurse who did the majority of the work there, but to play some small role in being able to do that. And I went home that day and I had a rough day and a lot of really sick patients, but I was like, you know what? We did good today. We made we made somebody's wish come true.
That's so beautiful. It made me cry.
Mm-hmm.
Yeah.
So I have a question. Throw one in for you, because Sarah and I've been talking this morning about boundaries.
Mm-hmm.
How do you set boundaries?
What's a boundary?
Yeah. We can relate to you because we've been talking about this.
And that's tough. And I struggled with that. And I mean, I multiple times had my coworkers literally kick me out of the hospital. Like, you need to go home. It's 8:30. Why are you still here?
And I know you enough to know that would be you, that they would be saying, you need to go home. You've been here 14 hours or way past and you need to sleep so you're prepared and ready for the next day.
Yeah. And I think I have learned, because I think part of it is that I've, had to show myself and convince myself that, you know what, you cannot necessarily be your best if you're working on 4.5 hours of sleep. As much as I would like to think that I'm Superman and that I'm invincible, I am not. I think a lot of us healthcare workers believe that we can just sort of continue to stretch ourselves to the ends of the earth. I think during COVID, that really broke a lot of people. Yes. It broke a lot of people who stretched themselves for a prolonged period of time. They also didn't necessarily feel like they were getting the support. I think there was a big frame shift in healthcare. I mean, being a trainee during that time, but just watching people around me and talking to people who were already done with their training and kind of their experience with it. I think it changed things a lot. But I think for me, it's frankly finding a job that forces me to go home, or I work fewer hours. So even if I go over, I'm not going to burn myself out. I've literally tried to build in safeguards because I know I have a hard time helping myself because I want to help other people. And I think it's also just reminding myself that you have got to take care of yourself, because there are definitely times where I have not taken care of myself as much as I should have been, and it affected me. And I really try not to let that translate into my work, but I certainly suffered. And there's nobody I can only blame myself for that. But I certainly suffered as a result of that. And so it's a combination of structurally putting myself in a situation where I'm not easily asked to do so much more, and then telling myself you have to take care of yourself.
Yeah.
That's hard.
It's rough. It's hard. I mean, it's like what you said, Vanessa. It's kind of within me to just I'm an empath. I want to help people. It's what drives me. But sometimes too much of a good thing is a bad thing.
Yes, I think all three of us on this episode can relate to that, to wanting to help people, being empaths, and really for our own health, having to learn how to set boundaries. And it's like a dance, right? It's not like, oh, I've set this boundary and then that's, it's like almost like a daily meditation or something of
Mm-hmm.
how did I do today? What, and reflecting again, like you said, Jared, which I think is kind of a form of meditation and a way of caring for yourself and like slowing down the nervous system and,
Mm-hmm.
being like, okay, this is so, yeah, I resonate strongly with that. Knowing boundaries are important. I'm working on it, but understanding that even though we want to help as many people as we can, that if we totally run ourselves into the ground,
Mm-hmm.
that we won't be able to help anyone.
Yep.
And our health will suffer. I have a family, my family will suffer. So I think like this topic is so important for everyone.
Mm-hmm.
Not just the three of us here, but I love that. Thank you so much for sharing these different ways. And at first you kind of laughed when I asked how you take care of yourself, but what you shared shows that you are actually doing that. Number one is you've picked places to work where they're taking care of you. They're being thoughtful about
Mm-hmm.
that, at least, right? Like, how do we take care of the doctors and nurses and other professionals working within
Mm-hmm.
this setting? So that alone is such a beautiful way to take care of yourself.
I think that the challenging thing though is you look at it from a global system standpoint is not every system is going to behave or treat you that way, right?
No.
I mean, our healthcare system is such a patchwork and variety of different things and different expectations. And when I was looking for jobs, I'm like, wow, I could make X amount more money or something, or I could go and do this. But then I looked at what the details were, and I'm like, okay, interesting. This
Mhm.
is the expectations of me. I'm like, I see how this is just going to end up being a bad thing for me because I can't help myself. But I also don't want to well, I'm going to take care of triple the number of patients. I can't do that and provide the same level of quality care. I'm not able to. I mean, maybe I'll get paid more money, but am I going to provide the quality that I want? And our system doesn't universally support doing that, support the highest quality care. And I think whether that is through time or through experience, whatever it is for that individual system, it just doesn't necessarily support you to do that. And so I feel bad for people who go and work at places where that's not necessarily the support.
Yeah.
As a
Because
go ahead.
I was just going to say, yeah, when you're working in those systems, you are just human. And so it will
Mm-hmm.
burn you out at some point. And
Yeah.
to put like kind of the onus on the individual within those systems to like somehow find time to care for themselves outside of these like
Mm-hmm.
extreme hours is unfair. Like it really, when those things happen, it's going to be detrimental to the medical professional and it's also going to be detrimental to the patients.
Yeah, and I wanted to say, just as a patient, knowing that my doctor in front of me that is treating me is not burnout and hasn't had a 16-hour shift gives me comfort knowing that you know, he's at his best right now in front of me when he's diagnosing me or he's making recommendations or, going into a surgical procedure, that he's well rested, he's focused. We all know the effects of lack of sleep and what that does to cognitive functioning. Another thing that I want to throw in there is I just love the fact, and you've mentioned this a lot, Jared, as I've gotten to know you over the years, but the fact that your mom checks in on you. I just love that from a mom. Being a mom, I would be doing the exact same thing with my child of saying, you take care of yourself because I love you and your patients need you. And I just think that is so beautiful that, you've said in the past too that your mom will like Instagram food or something for you. Not Instagram, but
Oh yeah.
Instacart.
During
There you go.
COVID, she would randomly. I would just she'd be like, Instacart is coming. I'd be like, oh, okay, great, thank you. She's like, hopefully you're home. I'm like, yeah, I'll be home soon.
But I just think that's so sweet that, we need you guys to, and I love the fact that your next job is making that a priority, knowing that patient care revolves around your mental health and that they're looking at that now because I talk so much about being trauma informed, and if you guys aren't taking care of yourselves as medical professionals, what kind of outcome are we going to have as patients? So that just makes my heart sing knowing that they're becoming aware of these things for you guys. Because I know you guys, you go on vacation and what's next to you is your phone, your pagers, beepers, all of those things that you're trying to relax and disconnect from work, which you deserve and you need,
Yes, yes.
but you're not being given that opportunity to disconnect, and you need that for the sake of your patients. And that just again makes me happy that they're looking at that now.
Yeah.
Little shifts.
Yes, yes. And just talking about it and putting this out into the world, these little things really matter. And if it even like can help a couple people, a couple, medical professionals, that's going to help hundreds of patients, right? So yeah, I think little shifts really make a huge, huge impact. The other thing that is coming up for me right now, and this is from the book, but Vanessa, you may have shared this on the other podcast episodes, but was Jared and your husband hung up pictures of you with your daughter on the wall in front of you so that you could be motivated to like remember like why am I working hard? Like why am I doing this? Why do I keep showing up every day in this pain, in this terror? And that's so beautiful and totally wouldn't be a possibility if Jared had been, had way too many clients on his roster. I don't know what the phrase is that you use, Jared, using like a coaching
Too many
phrase.
patients to take care of at that time.
Yes. Yeah. If you had so many, I don't think that would have been possible. And I just, when I read that in the book, Vanessa, I got choked up when I was reading about that, like how you woke up and you saw them there hanging the pictures for you. It just felt like such a beautiful way to show that they cared about you.
It goes back to them being able to look at me as a woman, a mother, a human being, not medical record 1, 2, 3, 4, 5.
Mm-hmm.
They knew that there was this woman in the bed, relatively young mother, working professional, and they knew based on and Jared, you remember this, my typing on my alphabet board.
Oh gosh. Oh
How
my God.
crazy. Yes.
Which, I'm sorry, we need to just take a little sidebar on this. Vanessa, as a speech therapist, is extremely familiar with those like alphabet communication boards. Dale and I, as not people who are super well versed in them, are watching her go like she's like texting on her phone, but it's way too fast. So we're sitting there like, what did she say? And it was driving her absolutely up a wall because she couldn't talk. And then we were too dumb to figure out how to follow her finger that fast. So
And
once
these
she
poor
figured out she
guys.
could text on her phone, and then that would actually show that, and then it was like, duh, yeah, this is so much better. But it was so funny because the provider became the patient, and it drove her absolutely nuts because we weren't as good as she was. But anyway, sorry.
Oh, I was like, if my arm wasn't paralyzed, those two would have had black eyes. Like I was so, I was so angry. I'm sitting there typing, "Where's my daughter? Or how is my daughter?" Like, and I'm typing really fast because the anxiety's flowing. I'm angry.
Yes.
I'm wanting to have answers to what's going on with my health and my family. And yeah, I was typing so fast, and he would say, "Can you do that?" And poor Jared, he was like, "Can you start over and say this again?" And I'm like, "Are you kidding me? I just spent 5 minutes constructing this sentence." And so again, it's like that love-hate relationship with me. I was like, "Oh my gosh, I'm going to kill you right now, but I just want to know how my daughter is." So that's when they were able to pick up like, wow, she's really anxious over her daughter. She needs to know, like, she needs a reason to keep fighting. She needs to know that people need her.
Yes.
So that's when the pictures came in. They had all these pictures, probably, I don't know, a dozen of them or so, 8x10s, plastered. And I remember right in front of me, and it's just seeing the two of them. And again, this is one of those emotional moments where Jared took my husband under his wing and was like, "Okay, we're going to make this better for her. I'm here for you as much as I am here for Vanessa." And Sarah, you nailed it too. Him being there for my husband relieved so much anxiety that I was experiencing because I, as a patient, was worried about him. I was worried that is he sleeping enough? Is he taking care of himself? Is he going to be able to handle what this is going to look like when I come home?
Yeah.
Is he going to be able to navigate taking his wife home, who a month ago was completely independent, to now helping her shower, tube feeding her? So my anxiety was so focused on him. And when Jared walked into the room, it was like, okay, Dale, you can go with Jared. You're going to be safe. You're going to be taken care of. He's going to explain to you what's going on. Jared came to him. They put the pictures up on the wall. It was my wallpaper. It was beautiful. And I vividly remember looking at those pictures on the wall and pointing at them and just giving Jared this like fist. And I would point at that wall and I would do this. And I was like, that's why I'm fighting. And I didn't want them to give up on me.
Yeah.
I didn't want to be that SLP patient in the bed that they were all talking about outside at the nurse's station, saying, she doesn't care. She's not doing anything. She's, depressed, anxious. I wanted to be that patient that, look, I'm fighting and I'm fighting for that girl on the wall. And don't give up on me. I know I'm like this medical mystery that no one knows what's going on right now, that you guys are all confused. No, there's no answers, but please do not give up on me. And I'm fighting. Even though I can't talk, can't move, don't give up on me. I'm still in here. I was cognitively aware, couldn't talk, but I'm fighting for that girl on the wall.
Yeah.
And that family.
And it's interesting too, because when you look like from the other side of this, right, from the provider side, right, it's so easy in a lot of ways, especially when you're really busy, you're stressed, your cup is empty, to look around the hospital, look around the clinic, look around the ICU, and see diagnoses instead of people. You say, oh, that's the young one with Guillain-Barré. Oh, that's the guy with the GI bleed. Oh, that's the patient with sepsis. And little things like that, like the pictures on the wall, having people's family members there. It helps to remind us in those times when we may not have the awareness or we may be running on empty. It's that little extra reminder that these are people, right? Yeah. I know I keep coming back to COVID. It was a formative experience, I think, for a lot of us, and especially for me in the middle of my training when it happened, when the hospital was devoid of people other than the patients and the providers, right? Yeah. We had patients on ventilators, although all the doors were closed. There were no family members. There were no balloons. There were no flowers. There were no pictures. They were just COVID. And it was dehumanizing.
Yes.
For the patients and for us, because you just feel like, okay, all I'm just thinking about is I'm making all of these decisions, and we're just, I'm thinking about their lung mechanics and what their ventilator settings are, and what antibiotics should I put them on, and you're not thinking, it's much harder to think about them as individuals. Talking to someone's family member on the phone every once in a while is not the same as having somebody there or bringing in, food from home or, whatever other sort of human touches. And it really, I think it sucked the life out of the hospital.
Yes. I think a lot of my team providers liked seeing those pictures on the wall too, because they would come in and ask questions about them. As the days unfolded, they would put more pictures up there. And I remember my PTs walking in saying, oh, now tell me about this picture. Or I see there's more pictures on the wall. What's this one about? And I'd get my little alphabet board and we'd have a little conversation about the picture and where it was taken. There were actually a lot of pictures on that wall that happened the week that I talk about in my book, right before I got sick and the camping experience. So they printed those pictures out from just a week before and had those on the wall. So I would talk to them about that. But I just think from the provider standpoint, it was nice for them too to like say, oh, wow, you are a mom. Wow, your child is young. Wow. And make that connection that, this is a real person here that's really fighting for life, and she wants to get back to that. So I really think it really helped the whole team having that. Now looking back at it, even the next hospital I went to, they weren't real thrilled about having the pictures on the wall, but the final rehab facility, they loved it too. They come in and ask me, and by that time I was able to communicate verbally, but we'd have conversation about them. I'd say, oh yeah, my daughter's coming today after preschool. And it was a conversation piece. And then when you have those conversation pieces, the anxiety, your mind is a little bit distracted from the profound health scare that you're going through. And it was just such a relief to have those conversations too about something other than, okay, we're going to try to extubate you today. We're going to try to sprint you. You're going to, and all this medical stuff where it just, my heart would just be flying off the charts because I fear. But when I would be talking about my daughter and the pictures on the wall, it was just more comfort, brought such a relief to me.
Yeah. Well, and talking about the fear and the anxiety, and then you even like Vanessa, when you were talking about like, I don't want them talking about me at the nurse stand, like I'm like the depressed person that won't do anything. I'm really curious about what it's like to be a doctor in the ICU, Jared, because I would imagine that most of the patients are absolutely terrified. And I would guess that most of their families are terrified. So you're walking into this, I think about the nervous system a lot, this like sympathetic charge danger, fight or flight, right? You're walking into these situations, like what it's like as the doctor. If you do see that with everyone, like, do you see that terror with everyone that's in the ICU?
I think we certainly do see it. I don't know if it's every single one, but I mean, nobody, when people ask me what I do, what kind of doctor I am, and if they don't necessarily know all the specializations, I say, well, I'm the doctor you don't want to have to meet, right? If you're meeting me, it's probably bad stuff is happening. I'm going to do my best to help you, but bad stuff is happening. And so people know when they get to the ICU, there's this connotation of, ooh, badness, something is happening. I'm really sick, or my loved one is really sick. Yeah. And so, and I know that going in, my expectation is that people are going to be scared. They're going to have questions. They're going to have a lot of emotions. I wouldn't say that everybody does, but I would say that a lot of people do, and rightfully so.
Yes.
And so one of the things that's always important to me as the doctor explaining things to the patient or to their loved one is to very clearly sort of lay out what I'm thinking, what I think is going on, why things are happening the way they are in terms that make sense to them. Right? And to let them know, look, I am doing everything we can, right? They're getting our absolute best. They're getting to, and I tell everybody, we're going to take really good care of them, right? And whether people believe that or not, that's up to them. But I always tell them that. I say, where people ask me, they're like, if I'm giving them a choice, and they'll say, I don't know. And there have been times where I'm like, look, if this were my parent, my brother, sister, this is what I would do. This is my medical opinion, right? And I just try to give people that reassurance. And I try to tell people, I can't necessarily sit at their bedside for 2 hours at a time and hold their hand and talk to them and help them work through the anxiety like I did with Vanessa. But I try to take, what I take out of that experience is I take snippets of that and I plug those little things in throughout my day. It's that little thing. It's like, yes, we're gonna take really good care of them. They're in good hands here. Or we're gonna do X, Y, and Z. I'm gonna call you at the end of the day, and then actually call them at the end of the day if that's the plan is. Or we're gonna talk tomorrow. Or when are you gonna come in? And I'm gonna come in and try to sit down and talk to them. And it's those little things here and there. It doesn't have to be some massive effort to all the time, right? You don't always have the time or the bandwidth to do that, but it's just taking that time. Right?
Yeah.
Or not even taking the time, but it's those little changes in things you say or your behavior or how you interact with people that I think can have a huge impact. I don't think that I think any layperson would understand that I got to go in and take care of business because your loved one is crashing and is, really, really sick. They don't expect me to sit there and hold their hand and be all warm and fuzzy. They expect me to like get it done and take care of business. And that's my job. And I view that first and foremost. But when you don't have those situations, it's how do you just work those little things in throughout your day that don't necessarily cost you a lot as a person, but to make a big impact on others.
Yes. Like making eye contact with somebody, whether it's the patient or the loved ones that are seeing this person that they love so much in this really critical health state. But to make eye contact and to say, like what you said was, we're going to take really good care of you, or I'm going to take really good care of your mother.
Right.
And like that phrase is soothing to me. And I'm not in the hospital right now. Like just hearing you say that is really soothing. And it makes me think too about, the mantras Vanessa and I have talked about too, is like just these really caring, thoughtful, human phrases can do so much. And like you said, it doesn't take a lot from the person
Exactly.
saying
We're talking
it.
about We're talking about like burnout and how do you take care of yourself full, but how do you do things that don't cost you anything? I remember when I was a resident, one of our faculty, she was a geriatrician, but she also would round in the hospital sometimes. She had this tiny little like folding chair. It was like almost like one of those little cane chairs you see older folks walk around with. And
Mhm.
she would wander around the hospital with that, and she'd pop that down in a patient room, and she would sit. And I just remember doing that, and I think that this is like a little odd. And then I realized the more I've done this, it's just something simple like I'm going to sit down or I'm going to squat down so I'm at their level when I'm talking to them, at least for a period of time. It's just these little things that I think that
Yes.
collectively go a long way that cost me nothing.
Yeah, they cost you nothing, but at the same time, what you have done is you have put thought and you are showing that it's important to you. So, yes, it doesn't cost you anything. And it may actually be one of the little things that fulfills you, right? To have that momentary connection. But the thing that I think is so beautiful, and I want to give you credit for, because you're saying it costs you nothing, but you've thought about these things. You've thought about that
Mhm.
woman who brings her chair in. You've thought about how to be human, how to show up and be more of a human in those situations. That makes such a difference because I've talked to hundreds of people I know at this point about their medical trauma experiences. So much of the trauma comes from not being seen.
Mm-hmm.
Because yes, there is definitely the trauma of these scary situations and these painful situations and not knowing if you are going to live or die. But the thing that I often hear from people more than that is that they were not seen. They felt unheard, unseen. They felt dismissed. And so these little shifts and what you're doing with people, even when you said you can't sit and hold their hand for 2 hours, but these little tiny things actually can minimize, possibly even prevent some of the trauma that people are leaving medical experiences with. And so I think it's a really big deal. I think it's a bigger deal maybe than you're giving yourself credit for.
Well, thank you.
Because it really, really matters. Like I feel chills right now because of how many people I've talked to who haven't gotten that, and like how you could have changed their lives if you were their doctor and they got that from you.
Well,
So, I mean, really, it means a lot. It really does. It's really significant.
There were some things that I experienced with him in the ICU, and I don't know if he even remembers this, but I do. I do. This is like goes back to the body keeps score. My body remembers these things. Just showing up with a box of tissue, knowing that like this is
Mm-hmm.
going to be very emotional for Vanessa. Here's a box of tissue. I'm going to come in, I'm going to have this conversation. I'm going to just kind of hold her hand. Husband's there. We're just going to have a 5-minute conversation with the box of tissues.
Yeah.
Another thing, I had an incredible spa day. Going
Oh
back to
yeah,
these women,
yeah.
yes, my husband, I remember telling you, like, wow, Vanessa is night and day. They just shaved her legs. They just
Mm.
washed her hair. As a woman, I'm laying in this nasty hospital bed for 3 weeks. Gross. Just those little touches were so amazing. Again, it comes back to having the time and the staff having the time to do these things. That didn't happen in 5 minutes. Trust me. It was not easy to take this woman from the bed to the chair, recline her chair, bring in a big trash can, dump water. It was a big ordeal. The last thing, and I don't even know if you remember this, but again, I remember they were trying to prep me for IVIG, or no, it was plasma at the time. I think they were giving at the time.
Plasmapheresis, yeah.
And of course, my veins were in bad shape. They
Oh
couldn't
yeah.
find, yeah, you remember that. That was just part of my anxiety. My veins were collapsing and nothing was working. And of course, all that just sent my anxiety through the roof. So they brought in a team, and I don't know what this team is called, so I'm not going to even try to even go there. But I remember these two men coming in, both of them very tall, very young looking men. And I'm like, oh gosh, these men have this machine, and they're going to use this machine to try to find a vein. My anxiety was like through the roof. So I'm thinking, holy, you know what? Like, if they don't find a vein, am I going to die? Am I not going to get this life-saving treatment? And I'm going to die. That's where my mind was going.
Mm-hmm.
And they came in. I'll never forget it. Two guys kind of towards the foot of my bed. You are right to my right. Dale's there too. And it was my right paralyzed arm. And they're like holding it up, you're holding it up, trying to like, and they've got the ultrasound thing doing what they do. Don't ask me what it was exactly, but and you guys were like sensing my anxiety. It was probably that obvious. They're probably looking at my beeping thing was probably going off the charts as normal, right? It was probably beep, 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 her anxiety, her heart rate's going. So then you guys were like, what kind of music do you like? And I'm like, oh my gosh, why are you talking music right now? We got better things to do, like save my life, get this vein. Long story short, I think I go into this in my book. I was like, I like Journey, and we're like, what song? Don't Stop Believing. Next thing I know, the guys have it on playing on their phone or something in my ICU room, playing. And I remember thinking like, oh yeah, because music is so good for just distracting and healing. And it took my mind to another place. And how easy was that? Get your phone out, turn on some music, Spotify, Apple Music, whatever. You can go to YouTube and get free of charge. But I remember laying there and thinking, I love this song. This is such a good song. And it took my mind away, even if it was for 2 minutes before they found the right vein that was going to work and they did what they did to insert the needle and all. You know how I was, Jared. That was not a pleasant time for me. But it just took my mind away that they were able to do their job. I was able to calm down a little bit and free.
Yeah.
And it was that humanized care yet again. Like that layer was there on top of the music being soothing and distracting.
Yeah. They tailored it to me. They were like, okay, this patient likes this kind of music. It was, again, another blessing that I look back and I think, wow, I was so lucky given a very scary time.
Yeah. This conversation's been really moving for me. I'm so happy to be able to talk to both of you. And I would love to give y'all both an opportunity if there's anything that you want to share with the listeners before we wrap up that you think would be impactful to them, or just something that you think is really important that gets shared. I'd love to provide an opportunity for you to do that now.
Go ahead, Vanessa.
I was going to say, go ahead, Jared. Gosh, I don't even know where to begin. Everything from, just don't lose hope. The medical journey is so hard, so scary. I have fought back from the trenches, and I'm so, so deeply grateful for people like Jared that were there with me during my experience. Then and now, look where we are now, still, chit-chatting and talking, and it can be such a beautiful experience, although very hard. And for me, I've had to really kind of piece through and remind myself the gratitude in the healing journey as well, of given a very, very scary time, there's so many things that I can still be grateful for, waking up in the morning and thinking, okay, like this morning, okay, I'm so excited about this interview. I'm so grateful for this. I'm so grateful for everything that Jared's done for me over the years and the friendship now that we have and these speaking opportunities. And it's just been so wonderful, and getting to know you too, Sarah. I've enjoyed this whole process with you. So thank you, thank you, thank you. Thank you to both of you.
It's wonderful. Yeah. I mean, I think this is just recapping kind of what we talked about before, is that the system can beat you down, or the day-to-day can beat you down. Absolutely. There is a lot that is within our healthcare system that could be better in so many ways, and I'm not trying to say that I can necessarily fix it. But at the end of the day, it's about finding ways to refill your own cup, and then finding these, like we said, these quote-unquote free ways that you can think about, how can I be better for my patients? And then know and take some satisfaction and gratification from knowing that you made your life better. And hopefully that refills anyone in healthcare's cup, any one of us who really went into this because we just wanted to help people. That should help fill it up. And so find those ways to, whatever it is for you or how you work, to do something that doesn't really cost you anything. We always think about, how do we have to give this massive amount or give more time or this? It may not even necessarily be that. It may just be these small little micro things throughout the day that can make a difference. And so just to not forget it, not to feel overwhelmed that you have to give so much more of yourself when you already feel like you're giving so much.
Right.
One other thing that piggyback on what he was saying is the importance of community. Sarah, you know how important I am about community and finding people that can get you through difficult times. Again, I'm just so grateful to have Jared part of my community over the years, and just the friendship now and the fun texts that we send back and forth now. It just lightens my load. But it's just so important to find that community and find people that you resonate with that can get you through these challenging times. It's been, for me, the difference between life and death sometimes, where, like, Sarah, you know that, wow, you know what, I'm waking up at 2 o'clock in the morning. Who's awake? Who can I lean on? Who can I talk to? Or it's 10 o'clock in the morning or 2 o'clock in the afternoon. I'm having some like flashbacks or anxiety of different things. What can I do? Who can I talk to? And those community and support groups are just so, so important. So thank you, Sarah, for doing what you're doing with your support groups.
Yes. Yeah. I agree with you so much. Like, we need community. We as humans will go through hard things. Every human will go through hard things. And I think the thing that keeps us going is other people. Like, and we're not all blessed to have like an extended family. We're not all as lucky as Jared to have a mom who's like checking in on him and sending him groceries. I mean, how wonderful. And what she does for you helps you be better for your patients,
Absolutely.
right? Every bit of that support. And so, yeah, a lot of us aren't that lucky, right? But there is support out there. And like, this is what Vanessa and I have talked about quite a bit, is there are a lot of different support groups. I started the Befriend Your Body community to be a supportive place. Vanessa is very dialed into a lot of different support groups for PICS and PICS family. And so I will put our ways to contact us if you're listening to this and you really do need some support. We are here. If we don't know the support groups, we will at least get you in contact with people who can help you get the support you need, because it can feel so isolating when you go through medical trauma. It can feel like you're the only person who's going through it, and you're not. But you do have to take the step to reach out and find support. We're making it easy for you because in the show notes, I'm going to put links for you to reach out to us if you want to find support. And I do also want to say, you know, Vanessa, we talked just a little bit about your book in this episode, but your book is beautiful and moving, and Jared wrote the foreword, which I think is so cool. And so I'm also going to put a link to Vanessa's book, because I think that's another way just to see you're not alone. You're not the only person who's gone through these really scary experiences and are struggling on the other end, because when humans go through terrifying experiences, we're going to feel different on the other side, right? We're going to need some extra support on the other side. That is normal because we're human. So reach out for support, find books that resonate with you. You're not alone in it. Y'all, I mean, I cried a couple times in this episode. This was...
Jared knows that I can't get through an episode with him without getting a few tears going. So he knows.
Yeah.
He knows me.
Yes, this was so beautiful. Thank you so much for sharing your time and sharing your stories.
Awesome.
Thank you.
Thank you so much for having us on.
Yeah. I hope you enjoyed this medical trauma support episode. I wanted to let you know that if you are looking for support as you're healing from medical trauma, you can join our membership community. It is called the Befriend Your Body community, and you can find out more at medicaltraumasupport.com.